Hi mamas, how are you doing? It's Andrea Tran from Breastfeeding Confidential, and I am here to talk to you today about why you would want to use a breast pump. Before I get started, I just want to tell you a little bit about myself. I am a registered nurse and a lactation consultant, an IBCLC, and I've been helping breastfeeding mamas for 25 plus years. Check out my website, Breastfeeding Confidential. I'm going to post a link to the post that I wrote about pumping, about everything you want to know about pumping, but today I'm just going to talk to you about reasons that you would want to pump. I'm also going to post a link to any products that I mentioned today. And if you have ideas for things you want me to talk about, drop me a comment and then I can, put that on my list of things to talk about in my next videos. And go ahead and check that subscribe button so that you'll be able to get notified of all my upcoming videos, because I talk about all things breastfeeding. So today I'm going to talk about reasons that you would want to pump, because this is one of the most common questions that I get from breastfeeding moms when they first start is, when should I start pumping? And my answer is, you should start pumping when you need to. And there's lots of different reasons that you would need to pump. Now, first of all, I want to say that if breastfeeding is going well, then I recommend that you just focus on breastfeeding for the first 2 to 3 weeks before you're thinking about pumping. And if something comes up, that you need to pump, then go ahead. And let's talk about the different reasons that you might want to pump. Now, I've got some notes over here, and I'm going to be glancing over there once in a while to make sure that I remember everything. So the first reason that comes up that moms sometimes need to pump is if their baby is born and doesn't want to breastfeed at all in the first day. It can be different depending on which hospital you birth at. But where I worked, if a mom had a baby and the baby was like sleepy or just not interested and 12 hours had passed by, we would get her started pumping, doing some hand expression. And I'm going to go ahead and put a link to that video because I talk about hand expression, but hand expression and pumping. So baby that's not breastfeeding, we would have her pump every 2 to 3 hours until her baby got interested in breastfeeding. And it would be the same thing if she had a baby that was sick and in the NICU and wasn't able to breastfeed. We would just get her started pumping until her baby was able to get going with breastfeeding. Sometimes a baby is breastfeeding great, but there's something about the situation that puts mama at risk for poor stimulation of her milk supply. Now, this might be a small baby. We used to have a cutoff of 6.5 pounds. If a baby was 6.5 pounds or smaller, then we would have mom do insurance pumping. And I'll talk about what I mean about insurance pumping when I get done telling you all the different reasons you might want to insurance pump. If you have a history of breast surgery, breast augmentation, breast reduction, sometimes even a lump removal or a biopsy, depending on where they went in and how they did the biopsy. So when they go around messing around with things in there, that can disrupt what's going on and sometimes create a problem with milk supply. So a history of low supply. A mom who has had a baby before and had problems with low supply, we would go ahead and get that mom doing some insurance pumping. If she's had a higher than average blood loss, if she has a baby with a real significant tongue tie that is not going to be revised right away, those are the most common reasons that we would have moms do insurance pumping. Now, what I mean by insurance pumping, you got a baby that's nursing regularly and well, but we just want to provide a little extra stimulation to kind of help ensure that you're going to have a good milk supply. And that means pumping right after feeding. And when I say right after, I mean within 15 or 20 minutes. And doing that about 4 to 6 times a day. You don't have to do it every time the baby nurses, but about 4 to 6 times a day after feedings. And we generally recommend, it might be just a couple weeks. It might be for the first 4 to 6 weeks. So that's the kind of thing you'd want to chat with a lactation consultant about to find out what their guidelines would be in terms of how long they'd want you to do that insurance pumping. Now, a question I get sometimes about that is, if I pump, isn't there the risk that I'll have too much milk? And that is a concern, but bigger concern is the risk that you wouldn't have enough milk. So another reason to pump would be if you supplement your baby with something other than your breastfeeding, whether it be formula, donor milk, whatever. Your body isn't getting that stimulation. Your baby wants to eat, and your body is not being told that your baby wants to eat. So that can affect your milk supply. So if you want to give a bottle of formula, then you should be pumping. Whenever you're giving the formula, if you need to give donor milk, you should be pumping whenever that needs to happen. Let's see. If you are trying to increase your milk supply, if you have low milk supply and you're trying to increase it, then pumping for 5-10 minutes right after feedings, that can help increase your milk supply. If you have a baby that's an ineffective nurser, it's just not very good at it. You know, that can be the small baby. It can sometimes be a baby that has the severe tongue tie, or just a baby that's not very good at nursing. Sometimes like a Down syndrome baby, because they don't have good tone. They can not be good nursers. Or sometimes we just don't know. Perfectly healthy baby and just does not have a good suck. So that might be another reason. And in all these kind of complicated reasons, I'm hoping that you're working with a lactation consultant so she can give you more guidance. But I just want to let you know that these are different reasons that a mom might be pumping. If a mom is engorged and her baby's having a hard time latching on. Now when baby's first born, breasts are nice and soft, baby gets lots of practice latching onto a nice soft breast, and then the milk comes in and they can get very engorged and it can be very hard for the baby to latch on. Now another video I did, I'll post a link, is reverse pressure softening, which is a way to help soften up the breast so that the baby can latch on. But sometimes moms prefer, you know, if the breast is full of milk, just pumping off a little bit of milk to soften it up is an option as well. If you want someone else to give the baby a bottle regularly, say your partner wants to go ahead and give a bottle once a day or once a week or whatever, when that is happening, then you would want to go ahead and pump, because of course you want to make sure your body knows that the baby wants to eat. If you're trying to build a freezer stash, if you're trying to pump that first bottle that you're going to offer, then you would go ahead and pump at those times. If there's going to be a regular separation, so for the mamas that's going back to work or school or whatever, then that's another reason that you'd be pumping. If your baby starts sleeping for long stretches in the middle of the night, this isn't true for all mamas, thank goodness, but some moms really can't go for a really long stretch without it affecting their milk supply. So if your baby starts sleeping longer stretches and you feel like your milk supply is going down, then you'll probably want to, you know, put a pumping in there somewhere during that long stretch of sleep. And in the rare, and it truly is rare, event that you need to pump and dump because you're taking a medication that is incompatible with breastfeeding. And most medications are compatible with breastfeeding. If you're not sure, Mommy Meds is a good app. You can check with a lactation consultant. Unfortunately, most physicians and pharmacists don't really know which medications are safe. Another place you can check is the Infant Risk Center. So just Google that and they will be able to give you information as well. So that's all I'm going to talk about today because I don't want this video to be too long, but those are the different reasons that you might pump. And I'll come back soon and talk a little bit more about pumping, about how you pump and what time and best times to pump and things like that. So let me know what kinds of things you want me to talk about, and hit that subscribe button and come visit me on Breastfeeding Confidential.